That's great. So we can see that we've got about 59 people signed in at the moment, and we are expecting more. But I want to formally welcome you to the COVID and BAME seminars. That's Black, Asian, Minority, Ethnic Community seminars. Week 2 of 5, a focus on diabetes, obesity, and working towards a healthier lifestyle. My name is Jackie Demirovska from the Cornerstone Community Church team, working together with James Henderson from the Transforming Communities Together team, and also Anne Horder and teams from Dudley Council, including Public Health, Communications and Community Development. As mentioned last week, or for those who are joining us this week, as a reminder, to let you know, the seminars are based on the ASH Foundation, that's the Aberdeen Street Foundation Faith and Health model, and we are building on these seminars as a community engagement platform to share important information on the impact of coronavirus on physical and mental health and wider health inequalities, care and well-being. So I wanted to say that this is important information for everyone in the community with a specific focus on the BAME communities. And when we say that, you could be living with someone from a BAME community, you could be working with someone from a BAME community, or you could know someone from a BAME community. So it's in that widest aspect. And we're obviously doing this given the evidence of the disproportionate numbers from the BAME community that have been affected by COVID-19. I just wanted to remind us of last week that we had the Acting Director of Public Health, Val Kaur. She provided, really it was comprehensive data about the effects of COVID on the Dudley community and how that compared with the wider Black Country and West Midlands. I think some of it is kind of hard hitting data, but really we do need to see that evidence. There was also the point that in terms of the BAME community, further information is required to break down some of that data. We also had Dr. Irvan Ghani, who talked about the test and trace program and the importance of that program, thinking about, looking at the symptoms again. If you feel that you have any symptoms, what you need to do, where you need to go in terms of obtaining a test, and depending on whether that test is positive or negative, what the next steps are. And as I said, we do have all of that information recorded on the Cornerstone Community Church website. We also had a reminder from the health protection nurse, obviously things around hand hygiene, wider health protection, washing clothes, these droplets, understanding how long it stays kind of in the atmosphere, and also face coverings, masks, and so much more. And also Shaz from Transforming Communities Together, just talking to us about how we can start to regather in communities post-lockdown. So as we get ready for tonight's session, I just wanted us to also think about the role of faith communities. As it was mentioned, the session from Ash was from a faith community. Of course, it doesn't have to be, but I think in terms of BAME communities, we want to think about the important role that faith communities play with this community. And this was also highlighted in the public health report by Kevin Fenton. So we want to think about, as we think about diabetes as well, as we think about sharing information, the faith communities, they can be a place of well-being, they can be a place, of welcome, and they also have knowledge of engaging with BAME communities. So at a local level, we want to think about who are and where are our points of contact in the community, and how do we address the gaps. So we want to think about, a sense of hope, So I don't know how you see yourself tonight. I'm hoping, although we're talking about diabetes, we may be looking at the physiological side, but I'm hoping you see yourself as a whole person, body, soul, mind, spirit. It'll be interesting, the meet and greet, to see how we see ourselves, but I'm hoping everyone will see themselves as a whole, as holistic. So we need that hope for a healthier lifestyle and future coming out of this pandemic. So just to conclude, that the challenge is a huge journey, and there will be many pathways to consider in looking after ourselves, listening to and caring, and may I even say loving our bodies, our soul, our mind, and our spirit. So, and also the evidence shows that the weathering of the body for people from BAME communities is impacted by pre-existing health conditions such as diabetes, such as respiratory issues. And again, this is evidence-based. There are multiple layers of socio-economic factors, including racism, housing issues, poverty, and access to culturally appropriate information. So we're not going to answer this, can I say, we're not going to have all the answers in 5 weeks, but we're just trying to, make a start by providing a platform to talk more about these issues. So let's hear more tonight from our experts in the field of diabetes, obesity, and working to a healthier lifestyle. Our speakers are Emily Ashman, Hannah Rigby, Kimberly Young, and Greg Southall. And now I'll hand over to Emily. Thank you. Thank you. Can we unmute Emily, please?
Sorry, I was having a few technical problems then. I'm not used to all these technical developments that we've had to deal with recently. And thank you, Jackie. And I think that's the most important thing we need to remember, is that we do need to remember that there's hope and there are always changes that we can make to make sure that we live healthy lifestyles. So I think that's a really good point. Thank you for that. And hi, yes, I'm Emily, lead nurse in diabetes in the community in Dudley. And we're really lucky to have Hannah Rigby, a diabetes specialist dietitian, here this evening, who will go through a lot more about how we can look after ourselves with diabetes and changes that we can make to make sure that we live a healthier lifestyle. So we're really fortunate that Hannah has joined us this evening. So I'd like to thank her for coming. Can we go on to the next slide, please? So we're going to go through what diabetes is and what food groups break down into glucose or sugar in our blood, and actually different changes that we can make to try and reduce that blood glucose in our blood, and how physical activity helps, which I know Greg will be discussing a little bit later in more detail than I will, but I will just touch on it a little bit later on. And actually what we need to do when it comes to managing illness with diabetes, and actually just tell you what support there is out there. And I think the most important thing that I want to stress at that point is actually contact your healthcare professionals, because we are here to help you. And if there's anything that you think we could do better, again, just please let us know at the end. And obviously there'll be an opportunity for some questions later on. Can I have the next slide, please? Thank you. So first of all, I just want to make sure that we've all got an understanding of what diabetes is. So diabetes is a condition where your body cannot control the level of glucose in the blood. I'm going to give an example. Hannah will go much more into carbohydrates later on, but at lunchtime I had a sandwich today for my lunch, and when that was digested, obviously it goes down into your digestive system, and those carbohydrates break down into glucose into the blood. We don't want the glucose in the blood, and this is where our pancreas produces some insulin, and it takes that glucose from the blood and into the cells for energy. And sometimes people, it may be that they may be a little bit overweight, or due to ethnicity and family history and genetics, sometimes the body doesn't produce enough insulin to take that glucose from the blood and into the cells for energy. We focus in this talk mainly on type 2 diabetes because that's where with the majority of cases of diabetes, and type 1 diabetes is a different, would be different things that we would need to do and would be another presentation in itself. But for type 2 diabetes, I think it's important that we can make diet and lifestyle changes that's going to help the overall control and health through these worrying times. Can I have the next slide, please? Thank you. So with diabetes, people from Asian backgrounds, sorry, I feel really strange that I'm not talking to people, so I'm really sorry. I just feel like I'm used to educating people and having feedback, so this is a really strange experience. So sorry about this, I've got all nervous. So for most people, coronavirus is a mild illness, but sometimes you're a bit more at risk if you have diabetes from Black, Asian or ethnic groups. If you're a little bit older, increased age, or you have a raised BMI, this also increases your risk of catching infections and maybe COVID-19. But we do really need to remember that there are things that we can do to our diet and lifestyle to minimise these risks. And I really don't want to make it sound like it's doom and gloom, because there are things that we can do to make sure that we live a healthier lifestyle. Having diabetes, if there's more glucose in the blood than there should be, it does make you more prone to increases your risk of catching infections. But we need to remember that we can contact our clinicians, ourselves, GPs for support through these times. Classic symptoms of diabetes, if it isn't controlled, could be that you're feeling tired because that glucose is sitting in the blood and not getting into the cells. You can feel like you've got no energy, you feel lethargic, and you just got no get up and go to be able to do the normal daily activities that you would normally be doing. Sometimes you can feel more thirsty and you keep on drinking, you can't quench your thirst, and this is also another sign that maybe your diabetes isn't as controlled as it should be. And because you're drinking a lot, it's like the waterfall effect that we call it, and you end up that you need to go to the toilet a lot more and pass urine. If you think these are signs and symptoms that you're having, I think it's important to stress that you must contact your healthcare professionals for help. We're here to help, and sometimes if you don't pick up the phone, we don't know that people may be struggling in their own homes. And we need to remember it is your diabetes. And actually, it is your right that if you think, oh, I'm going to wait for my annual review. No, don't wait for your annual review. Pick up the phone and say, can I have a review? I'm feeling tired, I'm thirsty, I'm passing a lot of urine, and I am worried that my diabetes isn't controlled as it should be. It may be that we need to look at your medications, review them, make sure that you're on the right treatment. But we have to remember it's a two-pronged approach. So we can give you all the medications in the world, but without the right diet and lifestyle changes, actually, that is the most crucial and fundamental change that all of us can do, not just for diabetes, for our general health and well-being. If we make sure that we look after our diet and do exercise, as well as looking after our diabetes, it also looks after our heart. And that's what we really need to remember and is very important. Obviously, I've just been saying that diet and lifestyle does make a huge impact on our diabetes. So I think it's important now that we hand over to Hannah, the dietitian, who's going to go through carbohydrates in a lot more detail than I can. So over to Hannah. Thank you.
Hello there, my name's Hannah and I'm the diabetes dietitian in the community diabetes team, working alongside Emily and other diabetes nurses. So as Emily said, I'm going to talk about the dietary management of diabetes, and we are going to focus on type 2 diabetes tonight, which is the most prevalent form of diabetes. So people with diabetes, 90% have type 2 diabetes, and it's the type of diabetes which can actually be modified by making positive diet and lifestyle changes, which I think when we talked earlier and it was all mentioned about hope, I think that is a key thing, that type 2 diabetes can actually be controlled, and we now know from recent research that actually it can be put into a state of remission even. So there's a lot we can do to improve things and make our diabetes better controlled. So I'm not going to give it an exhaustive dietary summary today, because that would be a longer presentation and probably a couple of presentations in their own right. But so I'm not going to focus on things tonight such as fat and fibre, which also there's a lot of information about that you will have come across. But I'm going to focus on the food group that affects blood glucose levels and some changes we can make to those, because I think it's often we're not as aware. We've heard a lot about fat in the media, whether it's good or bad, and a lot about that. But I don't think carbohydrates have been talked about as much. So I'm going to focus on that tonight. So as I said, carbohydrates are the main food group that affect blood glucose levels. We know that diabetes is a condition where there is too much glucose or sugar in the blood. So by reducing our portions of carbohydrates, that's one way we can reduce the amount of glucose in the blood. Okay, next slide, please. So this is a diagram to show us the different types of carbohydrates that there are in the diet. So as you can see on the left-hand side, we've got starchy carbohydrates. So these are things like potatoes, pasta, rice, bread, cereals. These all break down into glucose or sugar in our blood. And that's perhaps the more surprising thing if you haven't heard this information before. And I think it's our job as healthcare professionals to make sure everyone is aware of this. So, for example, a piece of bread is lots of glucose stuck together. So when it breaks down in your body, it can raise blood glucose levels. So it's important to look at the portions of these foods. That's not to say to not have these foods, but certainly looking at the portion sizes of them can really help. So that's starchy carbohydrates. We've also got simple sugars, which is another form of carbohydrate, which people are generally more familiar with. So that's table sugar and anything sugar's added to. So drinks and lots of processed foods. Then we've got the natural sugars, and that's milk and yogurt, which is lactose, natural sugar. And then we've also got fruit sugar or fructose as well. Next slide, please. So like I mentioned, the most important thing about carbohydrates is the portion size. So that's going to have the greatest effect on blood glucose levels. So if we have a big portion of carbohydrates, our blood glucose level is going to go a lot higher than if we had a more sensible portion. It's also important, that you will have probably heard about, to select whole grain carbohydrates or the browner versions. These contain more fibre, and therefore they break down a lot more slowly and cause more steady blood glucose profile. And this is, for example, whole grain and brown flours, whole grain and brown breads, and brown rice. But it's really important to mention, because I think there is a lot of focus on choosing these slow release carbohydrates, which is fantastic. But it's important to mention that these whole grain and brown carbohydrates will still break down into glucose. They may do more slowly, and that's great, and definitely better than the more white processed ones, but they will still break down into glucose. So portions of these is still important. Next slide, please. So I wanted to highlight this book. It's from the Carbs and Cals series, and I think it's probably the best thing out there to really show the effects of different foods and portions on blood glucose levels. It has pictures of different foods of different portion sizes, and then it shows blood glucose drops to show the effect that would have on blood glucose levels. In many editions of the Carbs and Cals books, but this is the one that I'm particularly focusing on, the World Foods book because it includes a lot of different foods, so from African, Arabic, Caribbean and South Asian cuisines. So it makes sure that the advice that we give to you is to your diet and your preferences and your cultural needs, whatever they may be, to make sure that you understand the information so that it works for you. So I would advise it's a really good book. You can get it from Amazon or from any good bookstore, really. Next slide, please. So as I mentioned, it's important that we talk about the different carbohydrates that we have in all different types of cuisines and diets, because it's not fair to just focus on them that might be more prevalent in the Western society, for example. So as you can see, this is some carbohydrates you may see in the South Asian diet. We have starchy dishes, and then we also have some of the simple sugars and some of the foods which may have simple sugars added to them. So, and then we've also got natural sugars, and then milk and yogurt, and then we've got fruit as well, fruit sugar. So like the umbrella I showed you earlier of the carbohydrates, but just showing different types of foods and making sure that that information is what you understand to whatever cuisine you have. Next slide, please. And then we've got this one for with Arabic foods. All these foods that I'm mentioning are from the World Foods book, so they have portions of those, and you can see what a sensible portion may look like. Some of the foods, because a starchy carbohydrate is flour, so anything that has flour in it is a starchy carbohydrate. Some of these foods fit into the starch and the simple sugar category on this diagram because they contain flour, but they also contain sugar. So therefore, they're going to contain more carbohydrate. Next slide, please. And then we've got some Caribbean carbohydrates here, grouped into the starchy, the simple sugars, the natural sugars, milk and yogurt and fruit as well. So I've actually made a mistake here in that I've put guava juice drink in the fruit, but actually all fruit juice we would classify as a simple sugar, which I'll mention later in this presentation. It's generally better to eat your fruit than drink it, just because when fruit is made into a juice, it's a lot more of a concentrated amount of carbohydrate. So we definitely, and also when it's eaten as fruit, more of the fibre is contained in its natural form, so it will break down more slowly. Next slide, please. Okay, and then lastly, we've got some African sources of carbohydrates that may be feature in the diet. It's really important that we make sure this information is relevant to the foods that you pick, because, for example, we usually say with starchy carbohydrates that a portion at each meal is about a clenched fistful cut off at the wrist, because obviously if people are larger, they're going to have a bigger hand, so that would be a bigger portion. So we usually say a portion of carbohydrates is a fist cut off at the wrist. And we say that usually for things like potatoes, pasta and rice. However, some of the more denser carbohydrates, for example, a couple of African ones here, so for example, fufu and gari or eba, so they are more dense carbohydrates in the way that they're processed, and so in the way that they're made. So actually a portion of those would actually be only half a fistful, just because they are so much more dense and therefore contain a lot more carbohydrate in a more concentrated form. Next slide, please. Okay, so this shows us and puts into context the starchy carbohydrates on a meal plate. So we've talked about that starchy carbohydrates break down into glucose, but this puts it into context how you might fit that in a meal, because as I said, people may reduce carbohydrates by different amounts and depending on what they want to do and what's right for their diet and what they need to do. So if we're reducing our portions of carbohydrate, this plate model is quite good to follow to show us how to start and how to get a balanced meal. So as you can see, we've got a quarter of the plate here is starchy carbohydrates, and the same examples of what a portion would be. Then we've got a quarter of the plate protein. okay, which we want to include at each meal, because protein foods are actually the most filling foods. I often hear people say that they think that they fill up on carbohydrates, but actually protein is the food group which actually fills us up most. So if you want to be full after a meal, it's a good idea to have a good portion of protein. And lastly, we advise to fill half of your plate with vegetables and salads, okay, to fill up on these foods. Next slide, please. So this looks again at that plate, and it focuses a bit more in detail on the portions of carbohydrates. So for rice or couscous, we may recommend 4 cooked tablespoons, okay, that would be about a quarter of a plate, or 1 medium flatbread, or chapati, or paratha, or pitta. And as I mentioned, if it was fufu or plantain or something like yam or cassava, it would be half of this size portion. Or sliced bread, it would be 2 medium slices per meal would be advised, ideally. If it was potatoes, it would be 4 egg-sized potatoes. And we also advise to make sure that carbohydrates fit about a quarter of our plate, to avoid double portions, for example, having rice or chapati or flatbread or potato. I think it's important to mention now, though, that as I've mentioned this plate, and this is the ideal, any reduction is fantastic in carbohydrates and is going to reduce blood glucose levels. So, for example, if somebody was having 6 pieces of bread at a meal, reducing to 4 would be much better. So it's about making realistic changes for yourself as well. If this seems far away from what you're doing now, and a third in terms of vegetable salad, carbs and protein is more realistic, then definitely that's going to have a massive benefit. Next. So I'm just going to talk about, I've talked about carbohydrates and the starchy carbohydrates and how they may fit on our plate. I'm just going to talk about a couple of the other foods that are carbohydrates. So one of these is simple sugars. So this is table sugar and anything it's added to. So we advise these foods to be minimized first when we're trying to reduce overall carbohydrate intake. And that's because they're sometimes called empty calories. They don't provide us with our body with any nutrition. Okay, and I think it's really important to mention that honey, syrup and brown sugar are just the same as sugar, and so should be minimized in the same way, because I think there are some myths around, and to do with how certain foods are advertised in the media, that people think that they're a health food or more healthy, but actually they're in fact just the same. The body reacts to them as if they were sugar, so they should be minimized as well. And in that way, we should try and replace sugar and honey in drinks and on food with artificial sweeteners. That's one way that we can reduce our carbohydrate consumption. And in terms of fluids, we want to pick plenty of sugar-free fluids to make sure we're nice and hydrated. So diet drinks or sugar-free versions. And as I mentioned earlier, when I talked about fruit, it's better to eat your fruit than drink it as juice or smoothies, because it's more intact form in the fibre. Next slide, please. And then lastly, in terms of carbohydrates, we've got natural sugars. So this is milk, yogurt and fruit. Generally, from experience of talking with a lot of people, people don't often overconsume milk and yogurt in terms of having a high carbohydrate intake. It doesn't tend to come from an excessive consumption of milk and yogurt. And also, this is also because it's important to remember that milk and yogurt are a very good source of calcium. So it's recommended that we have 2 to 3 portions a day of calcium containing foods. So calcium containing foods would be milk, yogurt and cheese, if we're talking about the dairy varieties that are going to affect blood glucose levels. But cheese does not affect blood glucose levels. Cheese is not a carbohydrate. It's a combination of fat and protein. So milk and yogurt are the carbohydrates that will affect blood glucose. But as I said, generally they should help to make up the 2 to 3 portions of calcium that we should have every day. So people don't tend to overconsume those. Fruit, there's a lot of controversy about fruit. I think it's important to mention that fruit does affect blood glucose levels, but it also, whereas sugar, I said, is empty calories and doesn't contribute any nutrition to your diet, fruit also contains vitamins, minerals and fibre. So it has an added health benefit. But I think it's important to remember that when we're thinking about getting 5 a day, that should include fruit and vegetables. So it shouldn't be 5 portions of just fruit. So for example, that could be 2 to 3 portions of fruit and 2 to 3 portions of vegetables and salad. And a portion of fruit or vegetables is 80 grams if you wanted to weigh it, or about a cupped handful, so the amount that would fit in a cupped hand. So that would be a fun-sized small banana, a medium apple, a quarter of a mango, sorry, and a handful of grapes or berries. Next slide, please. So this again shows the plate, and it just shows the protein, the vegetables and the salad, how they're added to it. So once you've filled your only a quarter of the plate, if that's what you've reduced to, of carbohydrates, starchy carbohydrates, so rice or chapati, or any other form of starchy carbohydrate that we've mentioned. We advise you to add protein to fill a quarter of the plate, and as I said, these foods are the most filling. It includes meat, chicken, eggs, also beans, and also other vegetarian alternatives. And we also want you to add vegetables and salad to fill up on. We can generally eat as much vegetables and salad as we like. They have only very small amounts of starch in them, so don't really generally affect blood glucose levels much. Next slide, please. And this is just showing how that might look in real life on your plate. So if we look from maybe somebody at the moment is kind of having half a plate of rice and half a plate of a curry with some source of protein in, or some dish, then moving towards trying to fill half our plate with vegetables or salad, quarter with the rice and quarter with the curry containing a source of protein. Next slide, please. So I think this is the last thing I talk about before handing back over to Emily, and it's been quite a controversial topic in COVID-19 recently. But so vitamin D is strange in the sense that, compared to the other vitamins, as it's one that we can't just solely get from food. There are some sources of vitamin D in food, but we need sunlight to make enough of it for our body. And vitamin D is important for bone and muscle strength, and it helps us to absorb calcium from our diet, which we talked about just before, from milk and yogurt and cheese. It's recommended actually in the UK before any of COVID-19 happened, that in the winter months, because the sunlight isn't very good in the UK in the winter months, that everybody should take 10 micrograms of vitamin D for good health during the winter months. But now we've seen that there might be an association. We think there's no concrete evidence. NICE have produced a report which shows some evidence that shows vitamin D may be people deficient in vitamin D may be more susceptible to respiratory viruses because they don't have as good immune function to these. But we don't have the concrete evidence yet, but there seems to be potentially an association. So it's really important to focus on vitamin D, I think, as well, because the recommendations, as I said, were already there for during the winter that everyone should take one. And also the recommendations were already there that anybody with darker skin or who covers their skin a lot, or who doesn't spend much time outside, and actually that might be all of us at the moment if we're during lockdown where we're having to stay inside more, anybody that I've just described should consider taking a daily supplement of vitamin D all year round to make sure that we're getting enough vitamin D. And generally 10 micrograms should be enough for most people. However, you may be advised, if you're found to be deficient on a blood test, your doctor may give you a higher dose, and that would be monitored then. We generally don't advise that people take more than 100 micrograms a day of vitamin D, because if we do have too much, can be detrimental for health. So 10 micrograms should be enough for most people, and that equates to 400 international units is another way that that's written. Next slide, please. Oh, okay, so we're on to physical activity now, which is also important to reduce blood glucose levels. So I'm going to hand over to Emily.
Hi again. So physical activity is really important. So we can all make changes to our diet, but actually any activity can help at all. So I know Greg talks about this in more detail afterwards, but we can't stress enough how important it is that we do sorry, that we actually have some physical activity in a day. The more time sitting, the more we're more likely to put more weight on, and also it's detrimental to our heart health. So it's really important that we get up and make sure that we do some activity during a day. Next slide, please. So yeah, so I know Greg talks about this a little bit more later on, but as well as the local park runs, we don't always need to, and people aren't always able to go out for a run. It might even be difficult for people to go for a walk. So I just really want to stress that it's important that any activity at all is better than none. This could be housework, gardening, but also for people who have more mobility problems, don't forget that there's lots of online resources on YouTube and on the NHS for exercises, for armchair exercises. And I think that's really important. And we have had people in the past under our care that have actually taken on some of these activities and have really improved their diabetes control. So it might be that you have problems with your mobility, or you might not be as mobile as you would like to be, but actually any exercise is better than none. Next slide, please. So I think it's important that we talk about in these times about managing illness with diabetes. So if you are feeling unwell, and as we've said before, that if your diabetes control isn't as good as it should be, you can be more prone to picking up illnesses and things. And obviously at the moment with Covid19 and coronavirus, that we don't want to put ourselves at more risk than we need to. So actually taking action with diet and lifestyle is the most important thing. When your blood glucose levels are high, you may feel tired, pass a lot of urine, and particularly thirsty. These are the signs, the telltale signs that your diabetes might not be as controlled as it should be. I'm really sorry if you can hear my dog crying in the background. She's just come back from her walk and she's a little bit excited, and I'm really aware that she's a little bit more noisier than we anticipated in the background, so I do apologise as we're doing this from home. So if you're feeling unwell, either if you're under our care, contact ourselves or your GP. I think it's really important that keep on taking your medications if you're feeling well, unless obviously if you're feeling sick or nauseous, you need to contact 111 or your GP. It's really important that with if you're feeling unwell or you're feeling unwell from your diabetes, it's your diabetes, and let people know that you're struggling. We do education sessions through Dudley, but also there is going to be support out there for you. So can I have the next slide, please? Thank you. I think I've got the slides round the wrong way round, you know, when it's confused me, so sorry about that. So if you're poorly with diabetes, it may be that you need to increase your blood glucose testing. When you test your blood glucose, if you've been given a self-monitoring kit, the most important thing I'd like to say is wash your hands before you test. Touching paper or anything can affect the readings. We like blood glucose readings to be between 4 and 7. We say 4's the floor and 7's heaven. Anything that's above that, you can start to become unwell. And if blood glucose is consistently above 10 millimoles, please contact one of your healthcare professionals. If you're feeling that your diabetes isn't controlled, or you've got your annual review coming, please make sure, I like to tell people this, it's your diabetes, so ask for help. So if people tell you you need to start to lose weight, ask how you're going to be able to lose weight, what changes, what support's out there to help you make those changes. Because I think it's easy that you're given a care plan and you're told and you're given these targets, and it can become quite overwhelming for people. And actually you should have support out there to help make these changes. If you are unwell or your blood glucose are higher, it's really important to keep on drinking sugar-free fluids. You may have seen us drinking here tonight, but we've got sugar-free squash, I do assure you, in our glasses. So there's sugar-free options out there, and you can drink these plentiful to just keep yourselves hydrated. If you are on medications for your diabetes and you're not tolerating any food, please contact a healthcare professional, because some of these medications might need to be stopped. And if you're vomiting or feeling nauseous, please contact someone as a matter of urgency. Next slide, please. Thank you. So who's there to support you? So we're the diabetes team in the community, and we are at the end of the phone if people need pointing in the right direction if you're not under our care. It may be that we ask you that you might need a referral to see us. I think one of the questions I've just seen actually is how safe is it to see your GP? If people might not be seen actually face to face at the moment, but there's always advice at the end of the phone. So please pick up the phone and ask for help. We do run the expert education courses through Dudley, and we're doing those online at the moment, particularly the first step. So if anybody's interested, you can contact our service and we can book you onto that, no problem at all. But also Diabetes UK, they've got some really good resources on there, and they are in all different languages. So there's information on there, and I think there's a helpline. There are local groups as well for Diabetes UK, and I don't necessarily think they're running sessions at the moment through Covid-19, but I know that they're eager to try and provide support. So there are local people on the Diabetes UK website that are there as a support. And I have to be honest, the World Food Books is brilliant, and I think it's a really good resource that you can see, and it just gives examples and it shows how much glucose food breaks down into. And I think, as Hannah said before as well, any changes is fantastic. So just reduce those portions where possible and get active in any way, shape or form. So thank you very much for listening. I'm sorry if I've got a bit nervous because it seems a very strange way of teaching. I'm not used to it like this. Next slide. Thank you very much. Do I have to? Do you want me to hand over to Kimberly?
Yes, please hand over to Kimberly now. Thank you so much, Emily and Hannah. I just wanted to interject there because that was just really excellent information, important information. And I think I can understand now, this is just personally, but I think I can understand now why they call it complex carbohydrates, because yeah, that information is really, really complex. But yes, thank you so much. And obviously we will have the opportunity to ask questions at the end of the last session.
Hi, can you hear me all right now?
Yes, we can hear you, Greg, thanks.
Thank you.
Brilliant, thank you. So I'm Greg Southall and I'm from Dudley Council Public Health, and I'm just going to briefly talk today just around physical activity and how we can maybe add more to our lives. Sadly, I've only got a brief amount of time tonight, so I'm just going to be talking about changes we can kind of make immediately into our life. So stuff we can do today, hopefully the stuff as well, it's things that can be done by people who are shielding. So we don't need to necessarily think about joining an activity group or anything along those lines. It's maybe about things that we can do at home or do in a space where we feel safe. So if I could just have the next slide, please. So first of all, Emily mentioned earlier that we don't have to think of physical activity as just like exercise. Physical activity is kind of anything that we do where we're moving. So anything that moves your muscles a bit more than they are when they're resting kind of counts as physical activity. So you'll see there's a little bit of an infographic on the slide there. And this is the Department for Health's kind of guidelines around being physically active for all of us. Now, I'm not going to bore you with the reasons why we should be more physically active, because we all know that being physically active is good for our health, and it can reduce kind of our risks of disease, etc., etc. But really important things to realise are that minimise sedentary time. I'm quite guilty of it sometimes. I'm having to work at home at the moment, and I find myself being sat down for long periods. I have to remind myself to get up, move around. That sort of stuff's just a good starting point for our health. It's also important to realise that every minute counts, and it's never too late to start. So we do a lot of work with older adults who've never really been active before, and we see big differences happening. Could I have the next slide, please? Now, how can we be more active? So there's no point in kind of thinking about things we're never going to want to do or not going to enjoy. So if going to the gym was never your thing, there's no point in kind of setting yourself up to fail. So you've got to think of things which would be enjoyable for you. So it could be you've got children. So could we do active play in the garden or in the house with children? That counts as being active. We'll probably tire ourselves out quite a bit. If you enjoy gardening and you've got a garden, you can do gardening. Heavier gardening is great for strength building as well. So things like digging, shifting stuff around a bit. We've also got allotments and community gardens around the borough. So those people who aren't fortunate enough to have a garden could still have a plot or access a community garden to do that sort of stuff. We've got great walking trails around the borough. So not just looking at things like canals where it's really narrow. We've got some really quite wide open spaces. So it's kind of a bit safer for us to get away, and we're not going to be close to people. And one other thing that's really important to remember is we should never stop doing manual tasks. Manual tasks, especially as we get older, are really important for us to kind of keep in our daily lives. Now, also, when we're thinking of being active, we need it to be convenient for us. So if we're going to have to drive somewhere quite far to be active, how realistic is that? Are we really going to keep doing it? Is it cost effective for us? So if we can think of things that's just going to be simple, cost effective, and we're going to be able to do it regular, that's really important for us. And finally, we've got, is it going to be really achievable for us? So I've got a picture of one of the marathon runners there. So are we going to try and set ourselves up to run a marathon pretty much straight away? It's probably not kind of a realistic thing. So if we can start small, it could be just start going for a walk around the block, and then we can maybe gradually increase and increase and increase, and we'll see those benefits happening. So how do we know if it's working? Well, one thing we can be encouraged to do is kind of just make notes of what we did the first time and how we felt. So that's a great way of looking back in, say, a month's time, of seeing, oh, I've gone further on my walk this time, or I've started running, I can do a little bit further, and I'm not getting so out of breath, and I feel great from it. Some people like to use activity trackers, so those little kind of Fitbit type things, they're really popular at the moment. They remind you to do more activity, but also you can track your activity, and that kind of keeps you kind of motivated for quite some time. One of the best things as well is, this is my favorite one, is you feel better the more you do, and you'll sleep better. So general lifestyle tasks just become a lot easier. Can I have the next slide, please? So at the moment, there's a lot of us who aren't comfortable going out. So where can we get more ideas? So our kind of national organisation who kind of oversees activity, they're called Sport England, and they've got lots of big campaigns going on at the moment, and they're big ones called Join the Movement for people who are at home, who want to be active at home. So there's stuff for older adults, there's stuff for people who are quite fit, people who have never done activity before, and stuff for children. So a massive variety of things, and there's things to suit everyone's different tastes. When things change a bit, or if you're slightly more confident going out, gyms will be opening, I think, towards the end of the month. So there's different things there. Our outdoor gyms have started to open up, and some activity sessions are happening. So there's opportunities that you can go and access there. if you want to think a bit broader, the Dudley Community Information Directory has lots of stuff. And the one thing I like to always recommend people to do, talk to family and friends. They know you best, so they might know what you'd like to try and do. And finally, if you do have an idea for anything that you think you'd like to set up in your own community, there is help out there to get started. So that's something we can discuss in the forum afterwards. So I've just noticed that I've had a message come up that asks what are manual tasks. So when we talk about manual tasks, it could just be anything that's done around the house. So it could be carrying shopping, it could be vacuuming, stuff where you're getting a little bit energetic and you might be carrying things and moving around quite a bit. Okay, so that's my little presentation. I hope to chat to some of you later. Thank you.
Thank you so much, Greg, and thank you for that comprehensive information and stepping in earlier than planned. That's great, and thank you, everyone. We can see lots of information and ideas building on the Sport England offer coming up, so I think we're all going to take advantage of that. Okay, I believe that we have Kimberly Young joining us by phone, so we'll hand over to Kimberly now and hope that she'll get through the Zoom gremlins and everything will be okay. So over to Kimberly. Can we unmute Kimberly, please?
Hello, can you hear me now?
We can,
Yes.
Kimberly.
Hello?
Try again.
Yes, fantastic. Hello, you're right there. Sorry about that. I'm not too sure what's going on with my internet at the moment. I think I've had too many meetings with work at the past couple of days, so I think it's given up on me. So if we can go back to the next slide, please. So just a little quick about the service again. Like I said, it is a free adult lifestyle service for anyone who is aged above 18 and lives, works, or has a GP within the Dudley Borough. So what you can do, like I said, if you do want to refer yourself to any of our services, all you would need to do is give us a call on the 01384 number on that poster. Otherwise, if you feel like you need to speak to your GP first or a nurse at the GP, feel free. And what you can do is once you do that, they can do the referral over to us. And when they do the referral over to us, we'll receive that and we will give you a call directly. So at the bottom there, it shows you all the services that we do provide. So we do a stop smoking service, we do weight management services, we do NHS health checks in the community, but we also do onward referrals. So with all these kinds of things, hopefully you'll be able to pick at least one of those things that we can help support you making a healthy lifestyle choice going forward. Can I have the next slide, please? So one of the big things with Covid-19, you might have seen the Quit for COVID campaign that the council has helped us with. There is a big thing about smoking and COVID. The reason being is if you are smoking, you are putting yourself at more risk of having a more severe disease through COVID-19. So this is the reason being is because when you are smoking, you are damaging your airways and your lungs. This then, because obviously we know that COVID-19 attacks the lungs and our airways, you're more likely to develop more severe complications. So with smoking, we want to reduce the repetitive hand movement, because when you are smoking, you are putting your hand to your mouth. And with this, it tends to provide an easier route of entry for the virus to enter your body. There are a lot of health benefits once you do become smoke-free. Straight away, you are going to start feeling that you can breathe a little bit better. And after 48 hours, all the gunk that you do that settles into your lungs when you are smoking, that will start coming up out as phlegm, and you'll be able to breathe a lot better. One of the things that we do say with stopping smoking is that if you do stop smoking, you are actually putting a lot less stress on the NHS too. So that's definitely a bonus to be able to stop smoking. Can I have the next slide, please? So With our service, we do provide a free 12-week stop smoking program. Alongside that, we do behavioural support. So you have a wellness coach who will talk to you about all your triggers, you know, what will happen, is anything that's happening when you're quitting smoking normal? Because a lot of the times you might have a lot of questions of what's happening to me, and is this actually normal? Am I meant to be having a lot of phlegm coming out? All those kinds of things. You can speak to your wellness coach on a weekly basis. And also, alongside of that, we do provide a 12-week of nicotine replacement therapy. So that would be your patches, your gum, your inhalators, your mouth spray. We provide that for free for the whole 12 weeks. So if you decide to sound like something that you would like help with, feel free to give us a call. A lot of people will say, oh, I've tried patches before, it wasn't useful, I don't think it works for me. A lot of the times, you might not have had that behavioural support. Behavioural support is a lot of the time you're 10 times more likely to quit with behavioural support. So if you would like that help, give us a call, like I said. There's another product that a lot of people might be aware of, and that is Champix. The Champix is a medication that you can get from the pharmacy. However, with the procedures of our stop smoking program, we would like everybody to try 12 weeks of the nicotine replacement therapy first and hopefully quit with that. However, if you do find that nicotine replacement therapy did work for you in the short term, you may be able to come back to us 6 months later to be able to try Champix. And that will be on a prescription, so there will be a little charge for that one. A lot of people might not want to speak to somebody about it, but are more comfortable maybe talking to our AI, so our artificial intelligence stop smoking coach, which is, her name's Bella. So it's a free app to download within the Dudley Borough. She's fantastic. If you wanted to talk to someone, just have a chat with someone about the stop smoking, just give her a bell and she'll be able to answer you back. Over time, and more people have been using this, so we do have a lot more information that we can pass over to you through Bella too. Due to the current situation, we are doing all of our appointments via telephone support and also given the option to do virtual support. The virtual support is basically through what we call Microsoft Teams, as you might have seen on as advertised on TV. We find that it's a secure network that we are providing our appointments through. So if you are interested, give Bella a download if you're using Apple or Android. And also with this, it will be really, really useful for you to understand kind of where you want to go with your stuff, with helping stopping smoking. Can I have the next slide, please? So another major thing that we might be worried about through lockdown, and we have had an increase in calls about, is an increase in weight. So through Covid-19 and the lockdown, a lot of people are probably reducing their physical activity, increasing their food consumption through snacking, picking different poorer food choices. What we do say is that obviously, with an increase of weight, you are going to be having a higher risk of developing comorbidities, so things like high blood pressure and potentially diabetes as well. So, and that can increase severity of COVID-19. So what we want to try and do with weight management is to give those healthier options a go, and also being able to provide you with that opportunity to understand what the healthier options are. So can I have the next slide, please? So I would like to introduce you to our 12-week weight management course. This is called Shape Up for Life. And before lockdown, we were delivering 2 types of this course, our Shape Up for Life Open and our Shape Up for Life Exercise. So the open group would be without exercise. So throughout this, what we do cover are things like nutrition, physical activities, your behaviour, your triggers, your goals, also about eating out too. So what we want to do is to increase your knowledge and understanding of what it is that we should be doing. We all know what we should be doing. We all think, you know what, I know what I need to be doing, but I just don't do it. So what the Shape Up for Life course is actually giving you the whys behind everything. So the whys of why we should be eating, from what Hannah said, what the amount of portion sizes that we should be eating, but also understanding why we need to have carbohydrates, why we need to have protein, and why we need to have our fruit and veg in our diet. We do give you a personalised weight loss target of 5% over the 12 weeks, which is around about £1 a week to be a safe limit. And what I wanted to bring to you is our brand new Shape Up for Life virtual that we have developed, excuse me, and that will be starting next Wednesday. So if anybody would like to join in with our Shape Up for Life virtual, do give us a call and we can get you booked in for that. So we do have a criteria, an eligibility criteria, which is a BMI of over 30. But for the BAME group, we do have a criteria of a BMI of over 27.5. So if you're unsure, you can give us a call and we can find out for you. And our telephone support staff are really, really helpful. Can I have the next slide, please? So some of you might have found that you might be cooking a little bit more through lockdown. What we're going to be doing is we are developing our Cook for Life course, which is a 6-week cooking course to help people increase your knowledge and your skill in the area of cooking. So with this, we tend to give you more information about nutrition, but also more about food hygiene, how we can bulk cook, how we can actually use different food items as a cheaper alternative. A lot of people don't know, how we can cook from fresh, and it actually can be quite cheap to cook from fresh. So that's what the information that we do give you. We will be giving information videos about those topics, but we'll also be giving you a follow-along cooking video. We were going to do a live follow-along cooking video, but we found that some people might get in a little bit of a fluster, because some people might want to rewind and see what we actually did earlier on. So what we're going to be doing with that is be sending out videos for that too. So if anybody is interested in that, do give us a call. Can I have the next slide, please? So you might find that those things might not be suitable for yourself. So we do have one-to-one telephone support or virtual appointments. These can cover any topic that you would like. So things like within weight management, physical activity, talking about positive mental health, but also if you need brief alcohol advice, we can give that too. So with that, we do set targets and goals with you, and we do give you a lot of information. It's all personalised to you. So if you did want to find out more, let's say about portion sizes, we can do that. If you want to find out more about what triggers you to eat certain foods at certain times, we can have a chat with you about that too. So with these, it's very useful for those who do have language barriers. We do have a multicultural team. So if somebody speaks a specific language, let us know. And we'll hopefully have someone in the team that do so, but if not, we can find someone within the Solutions for Health company who can actually help us translate. Just a note about our weight management courses. We, like Hannah said previously about diabetes going back into remission, we have had several positive outcomes with our weight management courses. Quite a few of them can be seen on the Let's Get Facebook page, where we do post our positive testimonials too about people putting their diabetes back into remission. So it is a positive thing, and if you're ready to make those changes, we are ready here. We're ready to help you make those changes going forward. Can I have the next slide, please? So just a little bit about NHS Health Checks. It is a signposting tool to spot early signs of things like stroke, kidney disease, cardiovascular diseases. And it is a really simple thing that we do in the community. So what we can do is it can be completed every 5 years for those aged between 40 and 74, sorry. So if you haven't had one at the GP practice, we can do it in the community for you, and it's very, very easy to be done with us. What is that we just have to ask you a couple of lifestyle questions and also healthcare questions. And then what we do face-to-face is that we will do a finger prick blood test. The finger prick blood test is basically to test the levels of cholesterol and also your diabetes risk. So if you haven't had an NHS health check, please do let us know and give us a call. We can get you booked in. And what we are doing to reduce the face-to-face contact, we are doing your mini health check via a telephone support or a virtual appointment, asking you all the questions necessary, and then we'll meet you for around about 10-15 minutes just to do all the measurements, your height, your waist circumference, the finger prick blood test, and it's really, really useful just as a signposting tool, just to understand what your health is, and just that MOT, just to understand that. Can I have the next slide, please? And just also to let you know the other referrals that we do, so things like the Steps to Health forms, which is to get 50% off the leisure centre prices, either as a pay-as-you-go or monthly direct debit. If that is something you're interested in, please do give us a call and we can send that form out to you. I know we've got Russ from Action Heart speaking next week, so if you do want some more information on that, please do join us next week to speak to Russ. We have Atlantic House referrals, so if anybody wants support with alcohol or substance misuse, please do give us a contact and we can pass you over. Same again with the self-management programs. There's somebody talking about it next week, so please join us for that. And as Greg mentioned earlier on, there are some more information on the Community Information Directory. And if you can't find anything, please do give us a call and we can help you with that too. So there are plenty of referrals that we do going forward. Have the next slide, please. So that is our contact details and my contact details too. So if anybody would like to access any of our services, please give us a call on the 01384 732 402, Monday to Friday between 9 and 5. You can always pop us an email, or you can visit the Let's Get website. That's my personal work email. So if you do have any questions for me, please do feel free to get in contact, and I will get back to you as soon as I can. Thank you for everybody for listening, and apologies for all the issues that we've had.
Thank you, Kimberly. That was fantastic, and well done for persevering with the IT issues. And thanks too to 4 wonderful speakers, and thank you for giving up your time on Friday evening to inspire us to change towards a more healthy lifestyle. And without more ado, I'm going to pass over to James for the first of our questions. Thank you, James.
Hi everyone, thanks so much for sending your questions through. The first one, I guess maybe for one of our dietetic colleagues, what's the difference between type 1 and type 2 diabetes?
That'll be a question for Emily.
Oh, yeah. Am I unmuted?
Yes.
Lovely. Sorry, I'm having technical difficulties here. As you can see, I'm actually a technophobe. So yeah, so type 1 diabetes can happen earlier on in life, and actually your pancreas doesn't do anything at all. It's an autoimmune disease that actually there is nothing that you can do about it. There's nothing you can do to prevent it, and you automatically go onto insulin. Yes, obviously we would recommend a healthy balanced diet, but your pancreas doesn't do anything at all. With type 2 diabetes, it's a lot more of a slower burn. So if people have carried increased weight, it's put extra pressure on the pancreas. So the pancreas, it's like an engine in a car. Eventually it just starts to wear out and doesn't produce enough insulin to take that glucose from the blood and into the cells for energy. So although they've got similar names, they are actually 2 quite different conditions. Is that okay?
That's really helpful. Thank you so much. I'm not sure who's going to be best answering this one, but somebody asked what size dinner plate should people use? Is there a good size to help people judge the portions?
Yeah. So Hannah's just said 26 centimetres.
Brilliant. Thank you so much. Thank you. It's good that you're both there together, socially distancing. Next question was, do darker skins need more vitamin D than people with lighter skins?
That's definitely one for
Hannah. So just definitely more at risk of deficiency of vitamin D, yes, because from an evolutionary perspective, darker skin was more prevalent in individuals who live nearest the equator where the sun's stronger. So the darker skin prevented from skin damage. But obviously if people of darker skin are now living more in more north, further from the equator where the sun isn't as strong, then they are definitely at more risk of vitamin D deficiency. Is that okay? Does that make sense?
Thank you. Our next question is also for you, Hannah. Some minority ethnic groups are milk or lactose tolerant. What would you suggest as alternatives to dairy foods, or perhaps people who are vegans?
Yeah, absolutely. So there are a lot of plant-based milks out there, which are absolutely fine. So like almond milk, coconut milk and things. Just need to make sure that those are unsweetened, because sometimes they can have a lot of added sugar added to them, and also that they're fortified with calcium to make sure that to make sure that they are we're back on, to make sure that they're fortified with calcium so that they will contain the calcium. There are other sources of calcium in foods that aren't dairy as well. So for example, nuts and green leafy vegetables are a good source of calcium as well.
Thank you, Hannah. Another one for you, Emily. How will you know if your blood glucose is more than 7 or 10 if you haven't got a blood glucose testing kit? Where can they be obtained?
So some of the medications you don't need a blood testing kit. So it's generally through symptoms that you'll feel that your diabetes isn't controlled as it should be. So if you're feeling tired, thirsty, or passing more urine, or you might be more prone to urinary infections because your body tries to pee out the glucose. So if you've got sticky urine, you're more at risk of infections. They might be telltale signs that your diabetes isn't as controlled as it should be. But I wouldn't advocate that everybody needs to be testing the blood glucose unless it was recommended by the healthcare professional.
Yeah, thank you. That sounds good advice. For Kimberly, a question here about why is the BAME BMI different for access to the course with Solutions for Health? It was lower, wasn't it? It was 27.5 instead of 30, 31. Yeah? Are you there, Kimberly?
If not, I can answer. Do you want me to answer?
Yes, Kimberly, are you there? Or if not, Emily, please do answer.
Yeah, I'm here. I think I was just muted.
Okay, thank you.
Yep. So we do say that with people within with the BAME group, they tend to be at higher risk. So we want to capture that the higher risk of comorbidity. So we do want to try and capture them as soon as possible before other comorbidities do develop. So we do say that if anybody is within that BMI criteria, do get in contact with us because we do have a lot of options for you.
Thank you. There's another question here. Are there any programs or information sessions for diabetes prevention for groups or community members?
Yeah, so they're run by public health. So at the moment, we only see people with
if they're started on medication for the diabetes, generally the GP will refer people into their team for structured education.
But for prevention.
Oh, for prevention. Oh, yes, you're right, Hannah. Public health.
Yeah.
Thank you. And Greg, a question for you about physical activity. Can you just give us a couple of points about the great diversity of physical activity options that are available to people from the BAME communities?
Yeah, so can you hear me?
Yeah.
Right, okay, so there's quite a lot of opportunities around the borough, but don't forget that group activities generally have ceased at the moment. So there are things like, for instance, maybe more culturally sensitive opportunities, such as ladies only swims. There's a ladies only socially distanced walk taking place soon. Creative, I think it's Creative Health is starting up. I think they're just starting to publicise it. We've also, it's not quite in Dudley, but one of the really big clubs that have taken off massively is a wrestling club that's in Wolverhampton, and it takes place at a big Sikh Gurdwara, and that has people from any background taking part, but accessing the Gurdwara, and they've done a lot of massive work there with the communities, bringing people together. But there's always opportunities to create more stuff. We just need community drivers who want to do more. There's funding out there, and we're willing to support people as well if they want to start something up that's more relevant to the needs of people. Okay.
So please do, if we've not been able to answer your question tonight, please email to the Healthy Communities email, or there's a phone number if you don't have access to email that you can also leave a message on, and we'll be following that up right through August. So if a question occurs to you later as things do start to come out more of lockdown and you think, oh, I remember that lovely lovely exciting and encouraging talk that we had to encourage us to start something new, maybe I could begin to do something looking after my health and well-being, being kind to ourselves and caring for ourselves in body, mind and spirit, as Jackie said at the beginning. We've had 4 absolutely excellent speakers, and I'm now going to hand over to Jackie for our meet and greet session and summary. Thank you.
Thank you, Anne. And I just wanted to, just before we finish the recording, I just wanted to offer a great vote of thanks to all of our speakers, just echoing what Anna said. Excellent presentations, you know, excellent information, and obviously all the links that have been provided as well. Of course, I want to thank all of the participants for all of you joining us tonight. And, you know, we're hoping that you will stay, obviously, for the short meet and greet. And also to thank our teams, obviously, behind the scenes at Cornerstone Community Church, at Transforming Communities Together, and of course at Dudley Council. So we're going to stop the formal recording, but of course we have the informal opportunity now to meet and greet the community. And you know, we recognise, as we say, that you know, so many people have taken time out to be on the sessions, so we do want to give that opportunity for people just to make comments if you've got any general comments, and just to give a greeting to the session. So at this time, we do invite you to turn on your videos if you would like to, and also just use the reaction by raising your hand if you'd like to speak. So